All right, this is the last section that we have to do with the toxicology unit. So bacterial toxins is what we're starting out with. These are naturally occurring substances that are being used as like bioterrorism stuff, or it can just be things that turn to be toxic, like botulism. It's a serious illness. It's a nerve toxin made by the bacteria. It's called Clostridium botulism. This is a test question on the CTE state exam, which I don't even know if we're going to have to take it this year since, you know, we're homeschooling now till May 1st. So who knows what's going to happen. Anyways, it's a test question. It is caused a poison released by some bacteria. So there's 3 different ways you can get botulism. First one and the most common one is food botulism, eating foods that have been improperly processed and canned. So like if your grandma or mom or somebody cans peaches, if the can lid is all like bubbly and not sealed right, it can create food botulism. And botulism results in lockjaw and usually ends in death. So you got to be super careful with it. Wound botulism occurs when the botulism spores contaminate a wound and produces a toxin. You don't see this very much. Back in like World War I, you saw this a lot more, but now we use like antiseptics and stuff like that to stop that from occurring. Infant botulism occurs when somebody under the age of 1 ingest the spores, and it's in honey, but it's in such a small amount that typically it doesn't affect anybody that's over the age of 1, but in babies it does. So you can't give babies honey because it can give them botulism. Okay, sorry, botulism back there, I said it was lockjaw. It's not. That is from tetanus, causes lockjaw. Botulism just leads to nerve damage and then death. And it's not botulism that's on the state test. It's actually tetanus, you guys. I'm sorry. Not thinking clearly. Okay, so tetanus is a bacteria that's found in soil, dirt, manure. It enters through broken skin. So if you get a cut, if you get cut by a rusty nail or a rusty piece of pipe, you need to be careful. Get a tetanus shot so that you don't get tetanus. You're supposed to get it every 10 years. So it is preventable. There is a vaccine for it. Tetanus comes from, I don't know why I didn't put the, anyways, it's Clostridium tetani is the name for it. And it produces lockjaw. It can interfere with you being able to breathe and also can result in death if not taken care of. But if you have tetanus, if you get it, you can get the shot and it's fine even after the fact. Okay, heavy metals and pesticides. Some suicides, homicides, and accidental deaths occur from exposure to heavy metals such as arsenic, lead, mercury. Mercury's in thermometers. You've got to be careful with that. If you ever break a thermometer, you can get mercury poisoning. Lead, they used to make lead-based paints, which they don't anymore. So lead isn't as big of an exposure anymore just because it's not around as much. Heavy metals enter this body through ingestion, inhalation, absorption through the skin. Heavy metals are stored in the soft tissue and can damage organs throughout the body. So pesticides, weed and pest control. There was a case a few years ago where the pesticide company had mixed their pesticides too much and sprayed the foundation of a home. And just from the foundation being sprayed, it seeped into the house and it actually killed 2 of the daughters. So you got to be careful with that. Lead, mercury, arsenic, cyanide poisoning is also a bioterrorism chemical agent. But these are things that terrorists use to kill lots of people. So ricin is made from castor beans. It's lethal in 1 minute of being exposed to it. And it just, even the exposure of like the head of a pin, which is teeny tiny, will kill you. The castor beans are processed throughout the world to make castor oil. But the ricin part is the waste part. It's the mash, and it's produced when the castor oil is made. And ricin has been used experimentally in medicine to kill cancer cells, but usually it's just used as bioterrorism chemicals. Anthrax is another one, Bacillus anthracis. It is a serious infectious disease caused by gram-positive rod-shaped bacteria, also known as Bacillus anthracis. Anthrax can be found naturally in soil. Commonly affects domestic and wild animals around the world just from getting it in the soil. This one, they had an anthrax scare probably 10 years ago. People were putting anthrax, which is a white powder substance, in mail and mailing it to people, and they'd open it up and they would just be exposed through skin. It was being absorbed into the skin and it was killing people. So it changed the way people open mail in businesses and stuff, that they wear gloves. And anyways, it happened a lot in Washington, D.C. They were sending these things and killing people with that. Okay, organs affected. These organs are affected by either drugs or alcohol. These are just some of the things that can be affected if you're addicted to drugs or alcohol or any of the other things we've talked about. So your skeleton organs, which are your bones, cartilage, tendons, ligaments. Alcohol interferes with the body's ability to absorb and utilize calcium, which creates osteoporosis. You're more prone and susceptible to injuries. So your muscular system is your skeletal muscles and smooth muscles throughout your body. Alcohol and drugs slow muscle movement and impair your coordination. Over a prolonged period of time, substance abuse reduces your muscle mass and puts you at risk for developing rhabdomyolysis, which is when your muscle fibers are broken down and enter your bloodstream. And that results in kidney damage and sometimes kidney failure. Your cardiovascular system, which is your heart, your blood vessels, your blood. Alcohol and drugs put a considerable tax on your heart, because if it's a depressant, it slows it down. If it's a stimulant, it's speeding it up. So it just kind of depends on what it's doing, which causes chronic heart diseases, conditions, high blood pressure, deteriorated heart muscle, irregular heartbeat, high blood pressure. Continually having high blood pressure can cause hormonal irregularities and stroke, can cause reduced blood flow, and it interferes with your daily life because you're not getting enough oxygen circulated. Drug and alcohol abuse can also...
Stuart Hills, can you call my number? Thank you.
Sorry. It can interfere with your blood clotting, causes anemia, which is not having enough red blood cells, and can contribute to cirrhosis of the liver, which we talked about with alcohol. It's where your blood is filtered, and if your blood's not being filtered, it causes toxins to build up and eventually leads to you dying. Your nervous system, brain, spinal cord, peripheral nerves. Obviously, your guys' brains are still developing until you're about 21 to 25. So that's why alcohol is illegal for you to use, because it impacts your development of your brain, and you don't want to become less smart because of alcohol. So make sure you stay away from alcohol. Your alcohol and drugs affect how you move, perceive, and think, and you feel. Alcohol is a depressant over your entire system and slows your ability to process information and how your body performs its basic functions. Drugs interfere with nervous system's ability to regulate your mood, thinking, coordination. Sustained substance abuse causes irreversible deep brain damage, which can manifest as memory loss, personality change, just not being able to think clearly. If you've ever talked to somebody that's been on drugs for a really long time, they are not intelligent people anymore because it destroys brain cells as well. Okay, respiratory system, your nose, trachea, and lungs. Respiratory system is responsible for delivering oxygen to your whole body. Both alcohol and drug abuse interfere with this process because it depresses your slows your breathing. When your breathing is slowed, it can lead to respiratory failure and depriving your lungs of oxygen. Oxygen deprivation can lead to brain death, which we've already talked about a lot. And depending on your drug of choice, you can also risk suffocation, choking, cancer, and other lung diseases. People that sniff drugs a lot also have problems with their nose, and sometimes it eats away the lining of their nose, depending on the drug. Your timer hasn't gone off yet. You have to keep reading. You have 2 more minutes. You can do it. Sorry, he's got 20 minutes of reading he's been working on. Okay, digestive system, mouth, esophagus, stomach, liver, small and large intestines. Drug abuse can lead to either weight gain or weight loss, depending on if it gives you the munchies or if it's suppressing your appetite, which makes you more susceptible to ulcers and gallstones. It can interfere with your metabolic processes, making it so that you're not getting all the nutrients that your body needs, which makes you more susceptible to diseases. Because your body doesn't have all the nutrients that it needs. It can also lead to stomach, esophageal, mouth, throat, and other cancers, and also cirrhosis of the liver, which we already talked about. Urinary system, which is your kidneys, your ureters, bladder, and urethra. Your excretory system removes excess materials from your body. When you have blood, when your alcohol abuse can interfere with the elimination of these unnecessary elements. It can cause constipation, diarrhea, fluctuations in urination. If the byproducts are not eliminated to your system, it can result in infection and sepsis if your kidneys and liver aren't working. More serious complications include kidney stones, urinary tract infections, organ and damage failure leads to sepsis, which is the toxins are being built up in your body. And if untreated, sepsis can lead to death. Are you seeing the key here? Everything leads to death and everything being destroyed. So don't do drugs and alcohol. Okay, and drink alcohol. Endocrine system. Glands such as your hypothalamus, pituitary, thyroid, pancreas, and adrenal glands. These are what regulate your hormones. Alcohol and drug abuse can impair the production and secretion of your hormones, blocks the absorption of calcium. Okay, there's your time. Osteoporosis and brittle bones can occur. Other compromised immune systems, erectile dysfunction, cardiovascular stuff. So again, messes with all your hormones, not a good thing. Okay, reproductive systems, ovaries, oviducts, uterus, vagina, and mammary glands in females. In the males, it's your testes, seminal vesicles, and your penis. So drug and alcohol abuse can affect production and processing of your reproductive hormones, testosterone and estrogen. For men, this can cause breast enlargement, testicular shrinkage, and impotence. For women, drug and alcohol abuse can lead to a decreased sex drive and menstrual irregularities. And both female and male substance abusers risk infertility and sexual dysfunction. So again, don't want to do drugs because it'll mess your reproductive organs up as well. So if you can see, drugs and alcohol affect every part of your body. A lot of people think that it's fun to do drugs, like getting that high and stuff, but the long-term side effects is not worth the recreational use of it. Okay, collecting and preserving evidence is kind of our last section here. How to handle drug evidence. You want to touch it as little as possible. You saw in that video of the officer that just got some of it on his skin absorbed through him, and he had an overdose reaction and needed Narcan to be brought back to life. So you got to be super, super careful. If they believe it's fentanyl, they will usually put multiple layers of gloves on before touching the substance. Because if just one layer of glove, the fentanyl can still be absorbed through the gloves. So handle the evidence as little as possible. Make sure you're using proper bags for it. Put it in a zipper bag, like Ziploc bag, and then a brown paper bag. If it's a liquid, make sure it's sealed tight in a airtight container. Make sure you've got your item numbers, initials, dates, seal on the container. Use tamper-resistant tape. This is all stuff we talked about back in Unit 2. But plant evidence, so like marijuana plants, if you're finding the whole plant, it must be dried thoroughly first. You don't take the roots. You don't want any of the dirt. Leaves and stems are stripped from the large stalks, packaged in paper bags and boxes so it can continually dry. If it's not all the way dried out, if you've collected the whole plant, if you put it in plastic, it will mold, mildew, and rot. If it's already marijuana that's been dried and it's in a zipper bag to begin with, Ziploc bag, it's fine. It's not going to mold and mildew in that zipper bag because it's completely dried out. So you can leave it in that. Large amounts of evidence collected should be subdivided into 30 pounds or less. So if it's a lot of meth, Usually it's already prepackaged when officers are finding it, but if it's still in the production form, they'll package it into 30-pound bags. Okay, liquids I kind of already talked about. Make sure they're in airtight things so they don't leak. Make sure they're propped up right when you've put them in the brown paper bag, and you want to mark on the bag that it contains a liquid. You can also put it in a Ziploc bag, then the brown paper bag, just in case it does spill. It spills into the Ziploc bag first. Biohazard evidence: syringes, glass, crack pipes, bodily fluids, razors, stuff like that. Make sure you leave the liquid content in the syringe. Put the syringe in a syringe container so it doesn't you don't get an accidental poke from that. Make sure there's biohazard stuff labels on your packaging so that people know when they're opening it it has hazardous substances in it. Glassware, all of that stuff, make sure it's in puncture resistant packaging because you don't want to accidentally poke somebody with it and have them get contaminated. Okay, that was the toxicology unit. Hopefully your takeaway from this whole unit is drugs and alcohol are bad for you. Please don't do them. And you see how scary, dangerous it is. One thing I didn't talk about because I wasn't thinking, back when we were on the narcotics, is pill parties. Going to a party and everybody brings prescription medication they stole from their neighbor's house or took from their mom and dad, and they'll dump it in a bowl and then they'll just take it. Such a stupid idea to ever do anything like that, because you have no idea what pills you're taking, or where they came from, or if they're going to have a side effect or a reaction with another pill that was in that bowl. So a lot of teenagers can die from pill parties because they don't know what they took. Also, taking something that your friend says, here, go ahead and take this, also stupid because you don't know what it is. If it's fentanyl, if it came from China, if it's highly, highly toxic because it's such a high dose. So please do not take anything your friend tells you to, because it could result in overdose and death. Even though you think you're just getting a high, it could be fentanyl. A lot of times, even if the person's selling you something else, it could be laced with fentanyl, because fentanyl is such a cheap drug that the drug dealers want their drug to go further. So they'll mix it with fentanyl or something else just to make it so that the drug goes faster. They mix it wrong. It's too high of a concentration and it will kill you. Drug dealers are just there trying to get the most money they can from selling their drugs. So obviously they'll do lots of shady things, which ends up killing a lot of people. So be super careful. Don't do drugs. Don't do anything that you don't know, that hasn't been prescribed from you. Don't be doing your friend's mom's prescription medication. You don't know what it's going to do to you. It's not smart. And yeah, that's about it. Hopefully you guys learned from this. Don't do drugs. Okay. See you guys.